changu chote cha maisha yangu nilikuwa mwalimu. Sasa kwa kuzingatia taaluma yangu na matatizo yaliyopo ndani ya taaluma hiyo, kwa hiyo mara tu nilipopata nafasi au nilipoingia kwenye eneo hili la kuwa mama wa Tanzania, nikaona ni jambo zuri na ni jambo jema nijihusishe katika eneo la elimu, hasa kwa kuwasaidia watoto wa kike na wale wanaoishi katika mazingira hatarishi.
Wanawake na Maendeleo WAMA Foundation is a non-governmental, non-profit organization founded by Tanzania's First Lady, Her Excellency Mama Salma Rashidi Kikwete, on October 2006 in Dar es Salaam, Tanzania, and was launched by His Excellency Dr. Ali Mohammed Shein, the former Vice President of Tanzania. The launching ceremony was attended by various leaders, including former Tanzania First Lady, Her Excellency Mama Anna Mkapa. The main goal of the organization is to improve the lives of women, girls, and other vulnerable children by empowering them to access education. Health in adolescent and sexually reproductive, maternal and infant health services, as well as capacity building for economic empowerment. 1. Advocate is one of the areas in WAMA's strategic plan. The department's main objective is to promote access to health and specifically sexual reproductive health services for women and the girl child, especially those living in remote areas of the country. This will help in the promotion of the well-being and create conditions of sustainable development of Tanzanians. The major activities of the department are: 1. Advocating for the reduction of new HIV infections by advocating for the prevention of mother-to-child transmission of HIV and AIDS, PMTCT. Advocate for elimination of unhealthy customs and traditions among pastoralist communities. Advocate for elimination of unhealthy customs and traditions among pastoralist communities. WAMA Foundation, under the leadership of Her Excellency Mama Salma Kikwete, conducted a workshop for pastoralist leaders. The workshop aimed at building the capacity of pastoral leaders of communities in 8 regions of Tanzania to address unhealthy cultural and traditional practices such as child marriage, wife inheritance, and female genital mutilation. These habits have proven to accelerate the transmission of HIV/AIDS, which may lead to death of both parents and increase the number of orphans in the community. Furthermore, child marriage increases the number of children dropping out of school, increases poverty in the community, and sometimes migration to the big cities. HIV/AIDS is a major health catastrophe and a serious development issue that has not been effectively addressed in remote areas of Tanzania. The workshop resulted with pastoralist leaders promising to disseminate the knowledge to the community and make sure all unhealthy practices are dropped. 2. Advocating for sexual and reproductive health and rights. Launching of the campaign to eliminate teen pregnancies. WAMA Foundation, in collaboration with Engender Health, under the financial support of USAID, launched a campaign aimed at educating girls in secondary schools to avoid getting pregnant while in school. This was followed by a 5-day workshop for secondary school girls and the teachers in 11 secondary schools in Temeke District. The workshop was officially opened by Temeke District Education Officer and was closed by the Temeke District Commissioner, Honorable Sophia Ndiema. 3. Complementing the government efforts in the reduction of maternal, newborn and child mortality by distributing medical equipment in the hospitals. Her Excellency Mama Salma Kikwete has been able to distribute medical equipment to 86 health facilities in the whole country. The life-saving equipment donated include mammography, X-ray machine, electrocardiogram, ultrasound machine, dental unit chair delivery kits and beds, incubators, oxygen concentrator, among others. Distributing ambulances in some remote healthcare facilities in need. Her Excellency Mama Salma Kikwete has distributed more than 5 ambulances to various inaccessible areas of Tanzania to ease transportation for pregnant women and children who need medical care. 4. Constructing a maternal health hospital. Advocate for the reduction of non-communicable diseases in the country. Promoting community mobilization for screening of breast and cervical cancer in the country. Her Excellency Mama Salma Kikwete, who is also the matron of Medical Women Association of Tanzania, MEWATA, in collaboration with the Ministry of Health and Social Welfare and the Medical Women Association of Tanzania, mobilized women in Mwanza, Tabora and Bahim to come forward to be screened for breast and cervical cancer. More than 4,000 women were screened and treated. Promoting human papilloma vaccination for girls aged 9 to 13 years. Her Excellency Mama Salma Kikwete, in collaboration with the Ministry of Health and Social Welfare, launched the first ever in the country vaccine against human papilloma virus, which can cause cervical cancer. Conducting high-level advocacy to regional and district health management teams to sensitize them to allocate funds to cervical cancer programs. WAMA also advocated to parliamentary committees, social services, and HIV and AIDS committee on the same. Her Excellency Mama Salma Kikwete is a member of high-level group for advocacy of adolescent reproductive health and rights in Eastern and Southern Africa. She is also conducting high-level advocacy to regional and district health management teams to sensitize them to allocate funds to cervical cancer programs. 5. Advocating for child immunization. Her Excellency Mama Salma Kikwete has been on the forefront in mobilizing women to send their children to immunize against childhood diseases. 6. Awareness creation and enhancement of knowledge on autism for better care of autistic children. Autism is Autism Spectrum Disorder, ASD, a term that is unfamiliar in many societies, let alone being understood. It is even unheard in some societies. This lack of awareness has led to misperceptions about the disorder and intolerance of people living with autism. Her Excellency Mama Salma Kikwete has started seeing the possibilities of helping these children by creating awareness to the community and has urged the Tanzanian community to support in the care of these children. All these efforts were possible in collaboration with different leaders and partners in the country and outside the country, such as Her Excellency Mrs. Michelle Obama, Her Excellency Mrs. Laura Bush, Her Excellency Mrs. Ban So-taik, Her Excellency Mrs. Pang Liuan, Her Excellency Mrs. Gusharan Kaur, Her Excellency Mrs. Gracia Machel, Her Excellency Mrs. Daniela Shat. Many partners have contributed on this success, like USAID, UNICEF, TACAIS, and AMREF.